Hello, this video is to explain what to expect when you attend physiotherapy consultation, particularly for patients that without prior experience. If you unfortunately require physiotherapy, what do you expect? Do you expect we do a lot of exercise with you? Or we crack your back? Or we do massage for you? Mainly, please don't confuse us with the masseur, please. Before we start, this is the disclaimer. I'm going to show you what you expect for a physiotherapy consultation at Family Care Physiotherapy Clinic as a private physiotherapy clinic. The session will start with consultation, subject examination, which means interview. I ask you some questions to understand you more, and objective examination, which refers to clinical examination, check for your movement, check for your pain. Then we will offer manual therapy and electrotherapy to relieve your pain. Most important is to teach you exercise and self-management. The normal regular session is about 45 minutes. The first part of the consultation is the most important because we need to know more about your condition to determine what we are going to do as treatment. So the interview is the most important part. We will ask a series of questions. Sometimes the question may be quite specific. For example, for adults around 30 years old, no matter men or women, I will ask, do you have young children? Because sometimes for men, if you injure your arm or leg, I wonder you need to carry your children. Or for ladies, for example, the back pain may be due to giving birth, okay, or due to the carriage. Okay, so that's why we ask. We ask about your job nature in details as well. For example, one of my clients is a reporter, journalist. So I literally ask what kind of reporter, journalist. For example, the finance, they don't need to go outdoor work. But for the sport or news reporter, they need to run around. So that's why the treatment and the reason of injury can be quite different. So manual therapy and electrotherapy, let me give you some example. For manual therapy, we do joint mobilization. We mobilize the arms, limbs, legs, and back or neck. Okay, not necessarily to be cracking. Spinal manipulation is one of our treatments, but not routinely performed. Okay, just do it as indicate. We'll do some soft tissue treatment. Soft tissue treatment because we do on the hands to release the tension of the muscle and relieve some excessive tension of scar. So some people are confused with massage. I also say I want to do some massage for you because I think massage is easy to understand. If I say soft tissue treatment, you may not understand. But bear me in mind that massage sometimes is quite deep and quite firm. It may not be very pleasant. So don't confuse with the leisure massage, please. For electrotherapy, I usually do ultrasound treatment to promote tissue healing after injury. And other type of treatment is electrical stimulation, quite effective to relieve pain, but for short term only. After electrotherapy or manual therapy, you may feel comfortable, but I have to tell you that, according to research evidence, it's very effective in short-term pain relief. How short is the short term? Is a few days to or a few hours. But most important is that after that, when you relieve the pain, how can facilitate you to do exercise and how you do self-management is rather important. And without consolidated clinical research, our clinical experience also show that manual therapy and electrotherapy that may be able to promote tissue healing after injury and relieve some soft tissue tension. I have to emphasize that sometimes if you visit other physiotherapy clinic, hospital, or other physiotherapy provider, they may or may not provide manual therapy or electrotherapy because of different training, experience, and also on your condition, case by case basis. So not necessarily all physiotherapy will provide soft tissue treatment, manual therapy, or electrotherapy for you. If you are not sure, you can ask. So after that, the hands-on treatment will provide more exercise and education. Especially, I will teach you how to manage yourself and write your memo or give you some exercise. Spend some time on it. Because if you see us is 1 hour per week or maximum 2 hours per week, but the rest of the time you manage yourself more than 50 hours per week. If you do something well, your pain will improve much faster. Otherwise, if you don't know how to manage yourself, the treatment may not be effective at all. One thing I want to emphasize is that you should understand your patient right. Same as other consultation with doctors, dentists, other healthcare professionals. In physiotherapy consultation, you only receive examination and treatment if you agree and comfortable to do so. If you are not comfortable with certain procedure, feel free to say it is your patient right. Very important. Don't need to be shy or don't need to feel bad at all. Not at all. Okay. Some treatment may be painful, but remember, not as pain as better. So remember, if you feel very uncomfortable or painful, feel free to feedback. Yeah, very important. Honest feedback is very appreciated. Don't have to always say kind words. Is that the treatment good is good, no good is no good. Just tell honestly, so we can adjust our treatment and provide better management for you. So really, we appreciate honest feedback. This is the video to summarize what you are going to expect for physiotherapy consultation at our clinic. Okay, so thank you for watching.